Great. Hello. Good morning, everyone. Thank you so much for joining us for our Public Health Careers Exploration Week. Our first day is Federal Government Day, and to kick things off, we have the United States Public Health Service Commissioned Corps. We are very excited to have them here today to talk a little bit more about their work and potential opportunities that might be available. So I'd like to start by introducing the team, and then I will hand it over to them. So to start, we have Commander Adelaide, Lieutenant Commander Ratliff, Lieutenant Commander Hin, and Lieutenant Commander Lindsley. So with that, we will have time for Q&A at the end of the session. For now, I think we're going to ask that you put any questions into the chat box, and I'll hand it over to the team to start.
So, yes, hello. So, I am Lieutenant Commander Ratliff, and I will begin with speaking about the United States Public Health Service. So, the United States Public Health Service Commissioned Corps, established in 1889, the United States Public Health Service Commissioned Corps is solely committed to protecting the public's health. The Commissioned Corps is part of the United States Department of Health and Human Services and is overseen by the Assistant Secretary for Health. The U.S. Surgeon General and the Deputy Surgeon General provide operational command of the USPHS Commissioned Corps. So I'll give you an abbreviated history, and there's a couple of places in here where I'll do an expansion of it just to give you a better understanding. So in 1798, the Act for the Relief of the Sick and Disabled Seamen. The Act for the Relief of the Sick and Disabled Seamen was signed into law by President John Adams on July 16, 1798. It was the first federal social insurance program and the beginning of the United States Public Health Service. The law was passed in response to a series of deadly yellow fever outbreaks in the American coastal cities. It aimed to protect against the spread of the disease from sailors returning from overseas ports. In 1870 was the creation of the Marine Hospital Service. In 1871 was the first supervising surgeon, later Surgeon General, Dr. John Maynard Woodward. In 1878 was the National Quarantine Act. The National Quarantine Act of 1878 established quarantine regulations for foreign nautical vessels pursuing entrance into the United States maritime ports. The United States statute declared it to be an unlawful pursuit for international vessels departing harbors termed as infected maritime ports to enter into the United States seaports and territorial waters. The Act of Congress authorized the prevention of communicable and transmissible diseases from entering or being introduced by any vehicle beyond the borders of the United States. In 1889 was the legislation which created the Commissioned Corps. In 1912, the Public Health Service broadened its powers. And you might say, well, what do you mean by broadened its powers? Well, in 1912, the Public Health Service established the broadening of powers when Congress passed a law that changed the name of the Public Health and Marine Hospital Service from PHMHS to the Public Health Service, which is PHS. It also authorized investigations into human diseases, sanitation, water supplies, and sewage disposal. It broadened the PHS research program to include diseases of man, contributing factors such as pollution of navigable streams and information dissemination. PHS is one of the nation's 7 uniformed services, and its officers wear uniform, bear military ranking, and serve on the front lines of public health. PHS's mission is to protect, promote, and advance the health and safety of the nation. In 1930 was the Parker Act, which expanded public health service to non-physical. Non-physicians, so then other professionals could also join, such as nurses, social, the social, social category, engineers, other categories other than physicians. So in 1955, there was the establishment of the Indian Health Service. In 1979, the Department of Health and Human Services was established. In 1999 was the first dedicated disaster response mission for the USPHS Commissioned Corps, which involved 20,000 Kosovo refugees. So in 1999, the first dedicated disaster response mission for the USPHS Commissioned Corps was to assist with the humanitarian crisis surrounding the Kosovo refugee crisis, where they were tasked with providing medical care and support to approximately 20,000 Kosovo refugees. The Kosovo War resulted in a large-scale displacement of Kosovo Albanians, leading to a major refugee crisis across neighboring countries. The Commissioned Corps deployed medical professionals to provide healthcare and support services to the displaced Kosovo refugees. This marked the first time that the USPHS Commissioned Corps undertook a dedicated large-scale disaster response mission. Who we are. The USPHS Health Service Commissioned Corps is one of the 8 uniformed services. Hold on a second, this is blocking. Okay, the USPHS, the U.S. Public Health Service Commissioned Corps is one of the 8 uniformed services, and it's the only one dedicated solely to protecting America's public health. 6,000 plus public health professionals dedicated to addressing public health and providing clinical care. One of 8 uniformed services, and the only one dedicated solely to protecting America's public health. Our mission and values: protect, promote, and advance the health and safety of the nation. Leadership: we provide vision and purpose in public health through inspiration, dedication, and loyalty. Integrity: we exemplify uncompromising ethical conduct and maintain the highest standards of responsibility and accountability. Service: we are committed to public health through compassionate actions and stewardship of time, resources, and talents. Excellence: we exhibit superior performance and continuous improvement in knowledge and expertise. These are our core values.
Thank you, Lieutenant Commander Ratliff. My name is Lieutenant Commander Lindsley, and I'm going to describe what we actually do. That has been a great introduction and good history. You may have seen public health service officers in federal agencies wearing the uniform or on TV during COVID. We were on the front lines. Day to day, we provide essential health services. We work with the vulnerable and underserved. As Lieutenant Commander Ratliff said, there are opportunities to deploy throughout the year. This may include a natural disaster, a disease outbreak, where a small team goes to a community, or something larger like a global public health emergency, or a humanitarian mission like the Kosovo mission. But we also lead public health programs and policy development. A lot of what you're learning in your coursework. There's opportunities in public health service to become a subject matter expert and really focus on a single policy or a group of policies, or learn about a program in such a way that you move up into a management position and you're leading the program and the budget. We also advance innovation and science. Some of us work in the lab, and so we may be at the National Institutes of Health or FDA, and we work on some of the biggest challenges like COVID and cancer and the opioid crisis. There are many benefits to service. We're going to get in a little bit more detail in future slides here, but a brief overview is that the beauty of this job is that you are expected to work in different agencies. And one of the key roles that we have that's different than the public sector is, or private sector rather, is that we are expected to move. That kind of mobility is ingrained in our system. So this allows you to work in different types of jobs, working in different opportunities within public health. And there are a lot of professional development. So that may come from your agency that you're assigned with, or it could be through our headquarters. We have several trainings throughout the year, and as long as you can get permission from your supervisor to attend, it may be a week training or a 2-week training. That could be specific skills for deployment, clinical opportunities to brush up on some of those clinical skills if you're a nurse or a pharmacist or a physical therapist. We also have great work-life balance. We can take advantage of all of the federal holidays as long as you're not in a position where you're providing care to patients. You know, in a clinic or a hospital, you may have to work during a holiday. And there are many financial advantages. There's non-taxable housing. We receive a substance allowance like the other branches, our sister services. There is good economic health benefits, including a comprehensive healthcare plan. We receive TRICARE. And then we'll talk a little bit more about this type of retirement opportunities, life insurance, survivor benefits. So we're stationed in federal agencies throughout the United States, more than 800 locations in all 50 states. There are foreign assignments as well with the World Health Organization, the CDC, and the World Bank. Here on the slide, you can see some of the agency logos. You may be familiar with HHS, of course, that first blue and yellow logo. So that houses many agencies I'm sure you've talked about in your coursework. For those of you that are international students, there's some smaller agencies that may be a little less known, like the Health Resource Service Administration. SAMHSA is the Substance Abuse and Mental Health Substance Administration, if I got that right, Lieutenant Commander Ratliff, and many more. So the EPA, the USDA, we have officers in many agencies across the country, and even within the immigration and prison system.
Thank you, Lieutenant Commander Lindsley. I will talk a little bit about our professional categories. So the Commissioned Corps is an elite uniformed service with highly qualified public health professionals serving the most underserved and vulnerable populations domestically and globally. Our professional categories include medical, dentist, veterinarian, nurse, therapist, pharmacist, dietitian, health services, engineer, environmental health, and scientist category. For readiness and deployment, the Office of the Surgeon General through Commissioned Corps Headquarters is responsible for the coordination of readiness and deployment. and we deploy for domestic and international operations, teams and individual. For examples, we have high profile or public events such as the presidential inaugurations or various official ceremonies. We also deploy for humanitarian assistance, disaster relief, emergency response, as we've talked about earlier in the previous slides, and global training. And we are recruiting, and we invite you to join our noble effort. The USPHS Commissioned Corps offers rewarding careers for public health professionals, and we're recruiting service-driven clinicians and public health professionals for the 11 professional categories I mentioned earlier. There are various opportunities for career growth within the PHS, including professional development, leadership training, mentorship, assignment mobility, continuing education credit, and post 9/11 GI Bill. Financial incentives include competitive compensation packages, housing allowance, comprehensive health care, student loan repayment programs, retirement plan, life insurance, and survivor benefits, as mentioned earlier. And additionally, there is support for work-life balance, including the 30-day paid vacation, which is great, and paid sick and maternity leave, and paid holidays. And you can learn more about all of this on our website, what we do, and the various benefits that we offer on our website at usphs.gov. And as mentioned in the previous slides, we offer comprehensive, low-cost medical, dental, and vision care for officers and their dependents. Another great benefit, which I have taken advantage of, is the 9/11 GI Bill, which can be transferred to your dependent. I'm actually transferring mine to my children. My son is about to apply to college. He's gonna get to use my GI benefit to go to college. So it's a great benefit, and it covers up to 4 years. And you get that after 10 years of service. We also offer diverse career opportunities, the ability to transfer from civil service or other uniformed services. So if you have prior military experience, you're able to convert that and keep your T&E time and experience will transfer over. And then, of course, what we're all about, which is protecting the public health, is to respond to disasters and epidemics. So you get to serve and give back that way as well. To become a public health service officer, interested applicants must meet the basic requirements and basic education and training requirements. They must also have the height and weight standards and maintain physical fitness and be medically qualified. And lastly, applicants must complete the commissioning process and secure a position in an agency where public health service officers serve. Lieutenant Commander Lindsley mentioned the different agencies where we do serve. And so you would need to secure a position in one of those agencies and process that simultaneously with your commissioning application process. And that process usually takes about 6 to 9 months.
Thank you, ma'am. My name is Lieutenant Commander Mika Huyn, and I'm gonna jump on here. I'm gonna let you guys know a little bit more about our service and our service component. So everyone on the call right now, all the lieutenant commanders and the commander is an active duty member. We are part of what's called a regular corps. So we are active duty uniform service officer. However, we have a daytime job. For example, I'm currently at the FDA, and you would hear the other officer introduce themselves and where they have work. So in our daytime job, I work at the FDA. But when there's a public health emergency such as COVID, Ebola, Zika, under the under the guidance of the president, the secretary, and the surgeon general, we can be deployed. So that is our regular corps component. So we go out the door when we are needed. But on March 27, 2020, the Coronavirus Aid, Relief, and Economy Security Act, which is the CARE Act, was signed into law. So this law basically provided both the authority and funding for the establishment of the Ready Reserve Corps, which is the Ready Reserve component of the USPHS Commissioned Corps. So the Ready Reserve is a little bit different than the regular Corps component in that it offers a unique opportunity for public health professionals who are mission-driven and ready to serve, but cannot commit to a full-time active duty position within the Commissioned Corps. So these officers are the ones that are currently still working at Hopkins, still currently working at University of Maryland Hospital, Holy Cross, pharmacists working in clinical care at CVS, Walgreens, but they also are a part of PHS, but just at a different level. So you can still have your public or private sector job, but when there's a public health emergency, again, such as COVID, hurricane, wildfire, with the permission of your supervisor, you are able to deploy. So it's not a full-time position where you have to wear your uniform every day, where you work for an agency that accepts public health professionals or public health officer, but you can work at a variety of different organizations and still have that service and community-driven component deployment to it as well. So our Ready Reserve officers are still able to respond to regional, national, and global health emergency and improve access to health services when they are needed. So along with the CARE Act that you previously heard, it also created the Public Health Emergency Response Strike Team. So the Public Health Emergency Response Strike Team, our first, is comprised of active duty public health officers, like the ones on the call today, but these officers are rapidly deployed to regional, national, and public health emergency. So when there's a deployment, it typically takes us a little bit of time to get our agency work in order. So for example, I'm currently at the FDA. Lieutenant Commander Lindsay is with IHSC. We have a daytime job. Like I can't just drop everything and be out the door in 8 to 12 hours. I have to, go through my supervisor. I need to make sure that my FDA work is covered. I need to make sure all of those layers are taken care of, because just because there's a deployment out there doesn't mean that the agency work drop. So there's a little bit of planning that comes into play. So when FIRST was created, these officers are rapidly deployed within 8 hours at the request of the President, the Secretary of Health, the Assistant Secretary for Health, or the Surgeon General. And their deployment also extend beyond what regular Commissioned Corps officer can typically cover. So it would extend beyond the 14 days. Before it was 14 days deployment, now is 30 days typically for deployment for the regular Corps, but these officers can stay there for 60 days, can stay there for 90 days. So that gives the regular Corps officer a little bit more flexibility, because FIRST can go out the door, and then once they've been there for, a couple of weeks and the regular Corps officer have some time to figure out agency work, figure out stuff at home, then we can come and supplement them. And then on the back end, the FIRST officer can come back and take care of everything at the end when the regular Corps officer, has gone home, gone back to their regular duty station at the FDA, IHSC, or CDC. So these two teams offer a little bit more flexibility on how we deployed. And currently, the public health emergency response strike team, our first, is based out of the DoD, specifically the Defense Health Agency within the DoD that take care of healthcare for active duty military members. So they are currently stationed at Joint Base San Diego in San Diego, Texas, Madigan Army Medical Center in Tacoma, Washington, the Naval Medical Center in San Diego, California, the Naval Medical Center in Camp Lejeune, which is Jacksonville, North Carolina, not Jacksonville, Florida, and then the National Capital Region, so within our region, Wateree and Fort Belvoir in Virginia. So when they are not deployed, these first officers staff these agencies, PT, physical therapy, nurses, pharmacists, MD, nurse practitioner, they would staff these medical treatment facility, help out with the clinical care at the facility, and then on their on-call month, they would do training if they're not deployed. So they're taking away from their clinical work. If a deployment comes in, then they can be readily out the door within the 8 hours and not have to figure out their clinical care work, who's going to take care of their patient and things like that. So very good options, both of first, Ready Reserve, and then also the active duty component provide great flexibility on what your career and what your personal life looks like.
So I'm back again. This is Commander Adelaide, and just want to share a little bit about my USPHS experience. I am a pharmacist by training. I am currently stationed at the Food and Drug Administration, FDA. I joined the USPHS Commissioned Corps in 2010. And I have worked in different offices within the FDA since commissioning in 2010. I currently work in the FDA Office of Compounding Quality and Compliance. Prior to that, I worked in the Office of Manufacturing Quality and the Office of Prescription Drug Promotion. Over the years, I've been deployed to various response efforts and missions. Some of my notable deployments include the COVID Response Assistant Field Team Mission, which is called the CRAFT Team in 2020, where we got to go to the hotspots all over the country and really liaise and talk with government officials to identify what the, problems and challenges they're facing, so we can take that information back to the White House task force and come up with solutions and different policies to help the different states out. So that was a very, very good deployment and mission. I learned a lot during that experience. That is true public health right there, because it had to deal with a lot of policies and how to create policies on the go. As you know, the COVID epidemic was huge, and we just had to keep trying to figure how to respond. Another notable deployment for me was the Ebola global response in Liberia in 2015. The picture to the right of your screen there is a photo taken at the Monrovia Medical Unit, which we call the MMU in Liberia, and where it's showing USPHS officers donning their personal protective equipment, their PPE, in preparation for providing medical care for Ebola positive patient. That was a 2 months deployment where we were out of the country, and we were on the ground, hands-on, teaching the healthcare professionals over there, as well as providing care to healthcare providers that had contracted the disease. So that was our mission. It was focused on healthcare providers that were positive with Ebola. Great mission, huge public health response there. And I've been on different various other deployments, but those are very notable ones for me and for my career. My email address is provided here. Please don't hesitate to reach out if you have questions, if you just want to chat about my experience or how to join the Corps and the different opportunities that the Commissioned Corps offers. I'm happy to help. Thank you.
Hi, I'm Lieutenant Commander Andrea Ratliff again, and I am a nurse with the Public Health Service Commissioned Corps. I am stationed, or I am with SAMHSA, which is the Substance Abuse and Mental Health Service Administration, and working there, I'm a public health advisor. My job there is to manage money or funds that the Congress gives to different organizations in places all over the world. So, and when they do this, they're helping with different, they have different focuses, like COVID. I'm working on a CMHC COVID focus, which are grants given by Congress to different states all over the world to help mental health patients recover and get back to a pre-COVID state. So that's what I'm doing now. And I was commissioned in 2014. After that, I went down to Texas and I worked with the Department of Homeland Security, ICE. And what I did down there was I helped ICE with these different people coming across the border illegally that needed to be screened and needed medical care. So I did that for a couple of years and I learned a lot from that. And then after that, I went to the commission headquarters and did some work under the Surgeon General and in the recruitment department. Just did a lot of things. I learned so much at headquarters as far as recruitment, as far as bringing people on board, what people needed, the different requirements of the Corps, the different factions moving forward, and just learned a whole lot. And my notable deployment was America Samoa in 2022. As you can see to the right, the first picture with the lady in the pink shirt was I had just finished vaccinating her. And the reason why we were there is because they had a low vaccination rate. People were dying due to COVID, and the vaccination rate was really, really low. And I've learned so much with this deployment, and I was so proud of it. And this is a culture that is just so different. They have so little as far as economics and things like that, but they're such a rich culture, and they're so proud. They have a lot to give to society. And when we left, their vaccination rate was over 80%. So I was very, very happy and proud of that. My email is at the bottom, is andrea.ratliff@samhsa.hhs.gov. Thank you.
Hi everyone. Thank you guys for allowing us to share a little bit about our experience. So I am a pharmacist by trade. I went to Montgomery College, which is not far from where you guys are located in Baltimore. And then I went to Notre Dame of Maryland University for my pharmacy school. I commissioned in 2018, right after pharmacy school. I went to the Indian Health Service in Lawton, Oklahoma to do my postgraduate training, my PGY1. After finishing my PGY1, I stayed there for about 4.5 years and did clinical work, because what would you do after graduating from pharmacy school? I was a young pharmacist wanting to do a lot of patient care, helping the underserved. So that was kind of the reason why I put on the uniform and went out to rural Oklahoma and served there for about 4.5 years, which was incredible. IHS will always have a special place in my heart, and I wish to go back someday. And then after that, my husband was like, okay, we've been here for 4.5 years. I need some greenery and, 4 seasons. So can we please move back to the East Coast? And that's what we did. I applied for one of the strike team position that you previously heard about. So I was stationed at Rockville in Region 3, working for the strike team under the Office of the Assistant Secretary for Health. After that, I went over to the FDA. So I'm currently at the FDA as a regulatory management officer. I work within the Center for Tobacco Products. So I see that as doing a lot of public health because even though tobacco and smoking is decreasing, vaping unfortunately is on the rise, especially with the increase of vaping and vaping device gearing towards kids. And I'm passionate about that because I have a 13-year-old brother. And peer pressure, influence, and everything like that. Social media is booming these days. So that is something that I want to do, not only for the public, but for my family as well. My notable deployment, my only deployment, unfortunately, is the Hawaii wildfires. I put on the uniform because I wanted to be deployed. I wanted to, be out there. I wanted to work, make a difference in my daily job, but also be out there when the community is at their most vulnerable moment. So when I commissioned in 2018, I couldn't deploy my first year as a resident. So at the end of 2019, I was like, okay, I got my go bag. I'm ready to go. Send me out the door anytime you want. And then COVID happened. And because we were at a clinical care facility, we kind of hunkered down because it wouldn't make sense to send your clinical staff away while requesting more clinical staff. So IHS, the Bureau of Prison, anywhere that was providing clinical care, hunkered down and kept all of their clinical staff, which, we were also responding to COVID. So that was my COVID deployment for 3 years. So I went to Hawaii for the wildfire back last year for 30 days. I did not go as a pharmacist. So when we talk about a lot of flexibility, a lot of, being able to wear different hats and being given the chance to do that, this is where I experienced that, because you would think as a pharmacist, I went there and was in the pharmacy, was dispensing medication, but I went there as a translator because there's a lot of Asian American, Hawaiian Native, Pacific Islander speaking native there. So there were people from the Philippines, people from China, people from Vietnam. So being that I speak, write, and read fluently in Vietnamese, I was there to support mental health, a mental health team. So the picture you see here on the left was us trying to set up a clinic that one day, because Lahaina all burned down. So the community basically lost there was no hospital. So the community lost their clinic, their primary care. When we were there, the kids were getting back to school. It was 2 months after the fire. So the kids were going back to school-ish. Therefore, we set up a healthcare brought-in provider from the different island. They flew in. We set up basically a healthcare clinic for vaccine, physical. Not only that, we did just fun things to bring back the normalcy for the kids. It was around Halloween, so we had a semi-Halloween party too, and we brought in hairstylists, nail salon, food, musician to not only give them that chance to get their physical and healthcare in place, but also provide that, hey, it's Halloween, we're gonna celebrate it despite everything that's going on. And on the bottom is my email. You can contact me anytime you have questions, concern, how to get in the Corps. I will be happy to chat with you. I will stop right there because I can chat about the Corps all day, any day, for hours. So I will let Lieutenant Commander Lindsay go.
Thank you. Yes, I can tell you're passionate. All of us are really passionate about this work because it's so incredible. Lieutenant Commander Lindsley, I am a nurse as well. Right from the start, I want to apologize for butchering SAMHSA's acronym in my earlier speaking role. Sorry about that. Thank you, Lieutenant Commander Ratliff, for providing the correct name of the agency. I work for Homeland Security, and I'm part of the Medical Asset Support Team, which means as a nurse, I go out for short-term assignments. These are not deployments, but rather a temporary duty. We refer to that as TDY. I'll go for 2 weeks or 4 weeks working at a detention center. Most are on the border or near the border. So picture Texas and Arizona, Washington State, Georgia and Louisiana, so southern states. And that's 50% of my role. So a lot of travel. I started the position in May and have been getting used to working in this type of environment. It's not prison, but it is corrections. These are detention centers, so it requires a great deal of safety and knowledge around providing good care, great care, but also being aware of your surroundings and the vulnerability that we may have in that environment. I speak Spanish fluently. I'm a returned Peace Corps volunteer from Peru and was not using my Spanish every day in my prior agency at NIH. So this is great for me to be able to speak Spanish really regularly, interpret, like my colleague has interpreted Vietnamese. The other 50% of my job is working from home. Like if you've had that opportunity, it's really a blessing for work-life balance. I'm in school part-time at Hopkins. I'm pursuing the Doctor of Public Health. And so my evenings, I can sign off from work and log into Course Plus and review lectures, read articles. So I spend a lot of evenings and weekends working towards my degree. I commissioned in 2019, and I was a civilian, a government GS employee at NIH. I was working as a research nurse with the National Cancer Institute, NCI, and I had learned of the Public Health Service. I was seeing officers walking the hallways in their uniform. I became friends with many officers and talked to them more about their role and their deployments and different agencies they had worked in. And having studied to pursue a master's in public health and a master's of science in nursing, I knew that this was a good career pathway for me. And so it took some time. I took it was quite a process to apply and go through the process, the steps, but I joined and went to officer basic course in 2019, and then almost exactly a year later, it was March of 19. In March of 2020, you know what happened. So I feel blessed that I joined PHS before the pandemic because it just opened up that many more opportunities for me to meet officers. Nurses were in high demand. You know, nurses were getting COVID in hospitals and clinics and unable to return to work. So we were able to jump in and deploy. My deployments were a little longer. There was one that was 3 weeks, but most were 30 days. And a notable deployment was one where I was went out to Anchorage, Alaska. The Alaska Native Medical Center was in need of nursing staff to help with their COVID patients, but to also support non-COVID patients. We often forget about everybody else in the hospital, right? People were still coming into the ER with burns, with other injuries, motor vehicle accidents, and they needed to be taken care of too. So we had a small team, multidisciplinary team. We've talked a lot about clinicians, pharmacists, and nurses, but there were team members on that deployment that were social workers and mental health counselors, that environmental health officers that worked in roles in the hospital, but also helped to support the mental health of our team. And so that was an incredible deployment. I had never been to Alaska. And on a personal note, it was also a win-win because I was able to meet two of my cousins that I had never met. We had talked prior, but when in my lifetime did I have an opportunity to go to Alaska? It's far, it's expensive. So I met both of my cousins and we made a plan that in the future we would plan another family reunion, but outside of COVID. So last summer, 2023, I brought my mom, dad, sister, and her two kids, and we left the East Coast and arrived in Anchorage and spent 10 days in the area. And we went to Denali and enjoyed some family time. And so it was a silver lining, COVID. My email address is also there. Feel free to contact me. We are all happy to talk to you about PHS and our experiences. And with that, we have a thank you slide.
Excellent. Thank you so much all for that presentation. It was really informative and just lovely to hear about your personal experiences. So with that, I think we would like to open it up for questions from attendees. I think probably the best bet would be to go through the chat. So if you have a question, feel free to submit it, and I can certainly read that off to the group. I know that we actually had one question from Jeanette Jeffrey in our office. Jeanette, I don't know if you want to pull yourself off of mute to ask that.
Sure thing. Thanks, Caroline. Hi, all. I'm Jeanette Jeffrey. I'm in the Career Services Office along with Caroline. And thank you so much for coming here today. I was saying to Caroline in the private chat that had I been younger, you are exactly what I would want to do. And the very first time I felt old was when I realized there was a restriction as to when you can apply. So could you let everyone know what that cutoff is so that they can seize the moment before they pass that time?
Ma'am, I have to say you don't look over 44, so you can still apply.
Well, I love you for
Reassuring
that.
us.
I'm far greater than that, but your work that you do is exceptional, and it really is a credit to our country that you are right there in the time of need. So 44 is the cutoff for being a commissioned officer?
Yes, ma'am. Yep.
Great. Thank you.
Yeah.
And thank you for your service.
Yes, thank you. Thank you for that. Let me just add that if you do have military time, they will offset that. So I think for every year of military time, they'll offset it by 2. So just, if that's still what it is. But I know it's either 1 or 2 years that they'll offset it according to how much military time you have. And all this should be on the website as well.
That's great to know because we do have a number of students that have military background that come into our program. So I appreciate that information.
And I know because I did too. Yeah.
Any questions from any of the students that are on the call today? I actually just saw one come through, so I will read that out from Yamil. Any advice for a NICU RN interested in policy work / relevant roles with USPHS?
No, I'll take that. Yes. Having worked in a NICU, puts you in a status, in my opinion, of incredible skills and knowledge in the clinical setting. So that's a neonatal intensive care unit for those that don't know. I can think of many places that your skills, either clinical or non-clinical, if you're more interested in policy now, um, could be valuable. Um, and so I would encourage you to email one of us, and any of the four of us can help describe more about our work. And I think we all touch policy in some way. You know, it's a big part of public health. So it would depend on what actually you're interested in, where there are vacancies, and just know that this is not a very quick, easy process. I compare it to the Peace Corps. I didn't fill out paperwork and go right to Peru, you know, within 6 months. It was more than a year. So just be patient with the process. We typically tell applicants that if they have a steady and good job, you know, just keep working in your job. The commission will come, but I think it's a test of the application process to see how dedicated you are. But yes, feel free to reach out.
So we had actually a great question come through the chat from Logan. And that is, how do you manage balancing deployments with your personal commitments like family or pets?
Just
I've been
having
to,
good support.
oh, can you hear me? Sorry. Oh, can you hear me?
Yeah, we can.
Okay, I just got a thing about my internet connection is unstable, so I may have been cut off a little bit there. But in terms of deployment and balancing work with family and deployment, it takes, once you commission, you know this is part of your job, and you know you can be called at any, depending on the type of team you're on. If you're a first team member, you know they go out fairly quickly. But the other of us, or some of us, don't. We have about up to 48 to 72 hours, 24 to 48 hours to deploy. So I have a deployment bag ready to go, and everything that has to deployment is in that bag. I've had that bag for years. You know, it's communicating with your significant other, your spouse. They know the plan if I have to go. So we do have an annual deployment plan that we have to complete now, where we kind of list our emergency contacts, our spouses, our children, everything is, so we have to update that every year and submit it to the Corps. It's all part of being ready and making sure your family is also ready. And if they need to contact your family, they can contact your family because they have all that information. But honestly, it's really just, it becomes part of you. Once you commission and you become a public health service officer, it's part of your life. And you're just always ready, right? You're just always ready. And you have your stuff ready to go. And your family, as long as you communicate with your family members, everybody knows that. Oh, I should also say this. We have on-call months, so it's just that it's not like we just get called randomly at any point in time. We all know when we're going to be on call. So there's a schedule that we get, and we know, okay, I think twice a year or so we're on call, or something like 2 to 3 times a year you might be on call. Correct me if I'm wrong, my colleagues here. So you know, you're expecting it, and that helps with planning. Thank you.
Yes, just to piggyback on what Commander Adler said, I think for me, it's like organization and teamwork. And I think, like she said, you have to have your ducks in order. You have to have your bag ready. You know, you have to have that conversation with your family and let your family know what you're doing from the beginning. You know, have your list, have a list, you know, and then go over the list, even when you're not ready to deploy. On off deployment months, talk to them about it, you know, what would you do, you know, in this situation? What would you do in that situation? Write down the key people that they need to contact if something happens to you. God forbid if you don't come back, they still need to know who to contact. So have that conversation, you know, and just it's just all about teamwork and organization. I have my mom living with me now, so you know, I'll have that conversation with her. So she has her own copy of the paperwork. I have friends that I know that I said, look, you know, my mom living with me and I want you to know she might reach out to you or whatever, or, you know, my friends are so good, they say, we'll reach out to her as well. So, you know, just to give you a tidbit, I think it's all about teamwork and organization, just to piggyback off what the wonderful commander said. Yeah.
I can take that on the chat. Can you describe the application process a bit more? Do you apply to PHS as well as any other agency you're interested in working at? So from personal experience, I would say if you are already at a agency that take public health officer, that might be the easiest because I tell people to do it simultaneously. Like if you're graduating, look for position within the CDC, FDA, USAID, Department of Defense, that have Commissioned Corps officer, because you can land that job. And then while you're in the process, also apply through USPHS, because if you're in that position already before you commission, you can just convert in place, like Lieutenant Commander Lindsay did. He was a civilian at NIH. He found out about PHS and he switched from civilian to Commissioned Corps. So I would say do it simultaneously. It's hard. The commissioning process can take 6 to 9 months. You just have to keep on it, because unfortunately our headquarters is super short staff. So I wouldn't just think that you commission and then the PHS is going to find you a job. Even if you go through the application process, it is on the applicant to find them a job. There's always a job out there, but it might be an agency that you personally or your family situation doesn't allow you to go. Because for example, after you graduate, let's say you work at Hopkins or something, and which doesn't take Commissioned Corps officer, and then you apply to PHS, and then you get in. PHS give you about 6 months to find a job at an agency that take PHS officer. So let's say if it takes longer than that, like you can't find a job at CDC, NIH, something on the East Coast, FDA, PHS would highly encourage you to take a position in a underserved population. So that might be the Indian Health Service, the Bureau of Prison, where they're always needing more staff and more public health officer. So if there's an agency that you want and there's a location that you want, I would look into that agency that take PHS officer and apply simultaneously, because you don't want to get through the commission process where they're like, okay, your paperwork is done, now find a job, and then also have to look for a job after that. So doing it simultaneously would be very helpful.
Great. Well, that was very helpful. Thank you for providing some context. And I know Matt also added in that it's very important that you're flexible and mobile and able to relocate. So we are just at time today. So I want to thank the team here at PHS for taking the time out of your busy schedules to speak with our students. It was a really fantastic presentation. Like I said before, I loved hearing about all of your individual experiences, and just how the work can vary so much. So with that, I do want to remind the folks that are on the call, our students, that we do have some programming coming up for the rest of the day. Next up at noon will be crafting your resume, and information session with the CDC. So we appreciate you tuning in then. Thanks so much, everybody, and have a great afternoon. Bye-bye.
Thank you.